Lenvatinib Capsule is a medication used for treating cancer. It belongs to a class of drugs called tyrosine kinase inhibitors, which work by slowing down or stopping the growth of cancer cells. It is important to take this medication as prescribed by your doctor. The dosage and timing of taking this medication will depend on your specific condition and medical history. Be sure to follow your doctor's instructions carefully and ask any questions you may have about taking Lenvatinib Capsule. Before taking Lenvatinib, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Swallow the capsules whole and do not crush or chew them. If you have trouble swallowing the capsules whole, you may mix them with water or apple juice, but be sure to consult your doctor or pharmacist for detailed instructions. If you are administering this medication through a feeding tube, ask your healthcare professional for detailed instructions on how to properly mix and give it. It's important to note that Lenvatinib may have different packaging and dosage instructions based on your medical condition, so be sure to ask your pharmacist about proper use to prevent dosage errors. The dosage is also based on your response to treatment and lab tests. For those using it for liver cancer, the dosage is also based on your weight. To get the most benefit from this medication, use it regularly at the same time each day. Do not increase your dose or use it more often or for longer than prescribed, as it will not improve your condition any faster and may increase your risk of serious side effects. Lastly, it's important to mention that Lenvatinib can be absorbed through the skin and lungs and may harm an unborn baby. Therefore, women who are pregnant or may become pregnant should not handle this medication or breathe in the dust from the capsules. Some common side effects of Lenvatinib capsule may include dry mouth, hoarseness, nosebleeds, tiredness, weight loss, headache, muscle/joint pain, trouble sleeping, change in taste, diarrhea, constipation, upset stomach, nausea, vomiting, or loss of appetite. Nausea and vomiting can be severe, but your doctor may prescribe medication to help with these symptoms. Eating several small meals, not eating before treatment, or limiting activity may also help. If you experience severe vomiting or diarrhea that doesn't stop, it can lead to dehydration, so be sure to contact your doctor if you notice any symptoms of dehydration. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. You may also experience pain or sores in the mouth and throat, so be sure to brush your teeth carefully and avoid using mouthwash that contains alcohol. Temporary hair loss may occur, but your hair should grow back after treatment. It's important to note that Lenvatinib may cause serious side effects, so it's important to monitor your blood pressure regularly, as well as lab tests for low blood calcium levels. Tell your doctor right away if you experience any serious side effects, such as signs of kidney problems, heart failure, an underactive thyroid, or any other concerning symptoms. If you experience symptoms of a heart attack, stroke, stomach or intestinal problems, severe back pain, fast/irregular heartbeat, severe dizziness, fainting, liver damage, or a serious brain condition called RPLS, seek medical help immediately. A serious allergic reaction to this drug is rare, but if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor. And if you experience any serious side effects, seek medical help immediately. Before taking Lenvatinib, it's important to let your doctor or pharmacist know if you have any allergies or if you have a history of certain medical conditions, such as liver or kidney disease, high blood pressure, heart problems, or dehydration. Lenvatinib may affect the heart rhythm, causing symptoms such as fast or irregular heartbeat, dizziness, or fainting. It's important to discuss any heart conditions or medications you are taking with your doctor before starting Lenvatinib. Low levels of potassium or magnesium in the blood can also increase the risk of heart rhythm issues, especially if you are taking certain medications or experiencing conditions such as severe sweating, diarrhea, or vomiting. Be sure to talk to your doctor about using Lenvatinib safely. Some people taking Lenvatinib may experience serious jawbone problems, so your doctor will need to check your mouth before starting the medication. It's important to inform your dentist before any dental work and to have regular dental exams while taking Lenvatinib. Before undergoing surgery, especially dental procedures, be sure to inform your doctor or dentist about your Lenvatinib use, as it may cause wounds to heal slowly. Your doctor may advise you to temporarily stop treatment with Lenvatinib before surgery, so be sure to follow their instructions carefully. If you are pregnant or may become pregnant, it's crucial to inform your doctor before starting Lenvatinib. This medication can harm an unborn baby, so reliable forms of birth control should be discussed with your doctor. It is not recommended to breastfeed while using Lenvatinib. Be sure to consult your doctor before breastfeeding if you are taking this medication. When taking Lenvatinib capsules, it is important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It is essential to keep a comprehensive list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is crucial not to start, stop, or change the dosage of any medicines without first obtaining approval from your doctor. This will help ensure the safe and effective use of Lenvatinib capsules for your specific medical needs. If someone has taken too much Lenvatinib capsule and is experiencing severe symptoms like loss of consciousness or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important to note that this medication should not be shared with others. Before and during your treatment with Lenvatinib capsules, your healthcare provider may conduct various lab and medical tests to monitor your blood pressure, heart function, urine protein levels, and the function of your kidneys, liver, and thyroid. It's crucial to attend all medical and lab appointments to ensure the proper monitoring of your health. If you forget to take a dose of Lenvatinib capsule and there are more than 12 hours until your next scheduled dose, take the missed dose as soon as you remember. However, if it is less than 12 hours until your next dose, it is best to skip the missed dose and just take your next dose at the usual time. It's important not to take a double dose to make up for the missed one. When it comes to storing Lenvatinib capsules, it's important to keep them at room temperature and away from light and moisture. Avoid storing them in the bathroom, and always keep them out of reach of children and pets. When it comes to disposing of Lenvatinib capsules, it's important not to flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, it's best to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for proper disposal guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.